Awesome. Yeah, so I work at Twine Health, which is actually right down the street at 3rd and Binney. We're in the Kendall Boiler Building, so if you know the history of Kendall Square, it was actually named after the company that we're in their building now. Just a little quick glimpse at what we do. So we're in healthcare, which is a huge field, sort of like saying I study computer science. But basically what we are is we're called collaborative care. So if you know what a health coach is, or you know what a DPC is direct primary care. So basically what it means is doctors or health coaches are people that, health coaches are people that are not MDs. They might be like registered nurses or something like that. And they basically can kind of coach you along your health goals. So whether that might be like weight loss, or if you're a diabetic, you want to lower your numbers, that sort of thing. But a lot of big companies like Microsoft and Google will hire health coach companies and kind of offer them to their employees and say, hey, we want you to be healthy. So if you can stay in touch with this health coach, she'll help you, lower your numbers for your diabetes, your hypertension, that sort of thing. Which is really good for the company, Google, because they want their employees to be healthy. They want them to be in the office. So we focus mostly on chronic illness right now. We're a pretty small company, so we started with chronic illness, like I said, like diabetes, hypertension, and we've seen really good results. So hopefully some of that is part of our video calling platform. So this is our stack, just to give you a quick glimpse. We're pretty straightforward, mean stack. Yeah, Mongo Redis, Elastic on the back end, with Node.js as well, all on AWS. And then on the front end, we use Angular across all of our devices, so we share our code base across every device. So the same code base that's written in JavaScript, we use it on the desktop, iOS, Android, Microsoft, everything. A big product and selling point of our application is coach-patient video calling. So our whole goal is to sort of create this, you could see in the earlier slide that even though we have all these fitness apps and that sort of thing now, there's really no sort of connectivity with your health coach or with your doctor. So our whole goal is to sort of create this experience where you feel like you're in the office and you can sort of emotionally connect with whoever's on the other side of the connection, which you don't really get that directly from Fitbit or that sort of thing. You can kind of track your numbers, but you don't get that sort of direct connection that a cancer patient or somebody trying to lose weight needs. And we've found that video calling is really successful in that sort of thing. Because a telephone call is great, but it's really nice to be able to see sort of that emotional connection, which earlier somebody talked on, where you want to see that gesture, you want to see that facial expression, and if you do something good, you want your doctor to sort of give you some reassurance, and it's nice to get a smile every now and then when you lose a pound or something like that. All right, so speaking more about our WebRTC stuff, our stun and turn server is on Twilio. Our ICE candidate exchange is all done through Socket.io. Like I said, pretty straightforward. We use 2 libraries for our client stuff, mostly for our iOS stuff. DetectRTC lets us, do our things like, do you have RTC capabilities? We support browsers across the board, but obviously WebRTC does not, or the browsers do not. So we need to make sure that they support WebRTC. Adapter.js, somebody mentioned earlier, but basically that's sort of our shim. So if specs change or certain browsers, things change. So this allows us to sort of write the code once and then forget about it for a while. On Cordova, we use a plugin called iOS RTC, which is sort of magical. It's really great. It lets us write our code in JavaScript, and then whatever we write on our client-side code, this will sort of compile it into native iOS code, just like Cordova does, and lets us run our WebRTC stuff seamlessly through iOS. Really nice. So our application, great on iPad, iOS, Android. Yeah, really fantastic, and somebody was asking me earlier about it. I really recommend it, and we haven't had any sort of flaws or anything like that, or sort of slowdowns with, you know, any of the video or audio. It's really great. So I wanted to share sort of a bug. I know we don't have a lot of time, but I wanted to share sort of a bug that we had that I could see sort of anybody that's using Angular kind of running into. We ran into it was a race condition, but it was sort of unique, and it's kind of nice to share what we're kind of working on. So we had this issue where, if you're familiar with ICE connection states, you know, you have like ready and checking and connected and that sort of thing. So we were stuck in checking, which if you've ever been on the Google group, this gets posted constantly. There's so many different ways you can get stuck in checking that it's ambiguous. And so furthermore, like we were working 5% of the time, and it was working with M50 and below, but not the newer versions of WebRTC. So we went through, and our first thoughts were, you know, are the ICE candidates like not being exchanged correctly? No. So we could look at the logging, and we could see, okay, looks good. All of the socket.io events seem to be running okay. The STPs look okay. The media started both on the callee and the caller side okay. And of course, it always works locally, right? It worked across the same network. Always does. Yeah. So I did a lot of debugging. I kind of wanted to touch on some of the ways that we were debugging. iOS RTC lets you dump a lot of the debug info, so basically every step along the way. It's really fantastic. So, you know, if you've ever debugged like Cordova or that sort of thing, you can hook it up to Safari, and you can open the console, and you can see the logs as they happen. With iOS RTC, and I don't know if you can see some of these logs here, but basically, when I say every step, I mean like every time an ICE candidate was sent or received, every time the media refreshes, that sort of thing. But this looked good, so it was sort of clueless at that point. And then I sort of went on and I analyzed the SDPs, like the remote and the local ones. And yeah, both looked great, you know, correct audio, correct video, that sort of thing. Went further, looked at the WebRTC internals, which if you're unfamiliar with that is basically Chrome has a way to sort of record, so you can set it to start recording, and then you start a WebRTC call or a WebRTC connection. It'll record basically everything that occurs during that call. Really useful, really verbose in a good way. And then, of course, I went on Google Group, and yeah, a lot of help. I'm sure there's probably one or two of you that I probably read one of my messages. Yeah, if you responded, thank you very much. So what ended up happening is I noticed I did a lot of my own sort of console logs, and I noticed that the client or the caller was sending about 30 plus ICE candidates, and the callee was only receiving about 10 of those. And so I didn't think at the time that, okay, that's fine, right? It should pick one of those 10 and it should be okay. And then I sort of realized, like, okay, maybe the ones that it's missing, those are actually important. And it turned out that it was. And so what our problem was, and I'll sort of dive into Angular a little bit here, sorry if you're not familiar, but so we had an Angular controller that wasn't being instantiated until the call came in. So until the call came in, like the actual socket.io event for a call came in, it wasn't instantiated, and inside that controller was where we were receiving the ICE candidates. So the reason it was working 5% of the time is because it would be instantiated in time, and it would start receiving the ICE candidates. All the other times, ICE candidates were being sent before the actual call, so it wasn't receiving the ones it needed. So very simple solution. We just moved it to a factory that was already there, already loaded. We collect the candidates as they come in, and then of course when the call comes in, then we have an array of all the candidates. We can just go right through them, and you know, that seemed to work. Some of my favorite resources when I was debugging, Google Group, shout out to Google Group. And then a big one actually, and especially this was really great because I started to bring in some of my coworkers to help me out. You know, I could have a meeting and explain the situation, but this graphic on the right, and I have a link to it on the left in case anybody wants to go through the slides and grab it. It's a great sort of diagram of the whole WebRTC framework and the flow of it. And this sort of helped me specify, okay, you know, this is the point that we get to, and this is exactly where we're failing. And this was fantastic. It's sort of an easy to read rundown, and I don't have the name of the person that created it. I wish I did.
Alex Guillard.
Oh, okay. Fantastic. Yeah. It's a very wonderful diagram. And then lastly, yeah, shout out to WebRTC Hacks. I didn't post it. It's a long page, but yeah, the SDP anatomy, which if anybody's ever done anything with the SDP, you probably have been there. You already know what I'm talking about. Sort of the future of what I'm working on now at Twine that I didn't have done yet to show you guys that I'm working on now. Logging. So one of the sort of pain points that we had when I did the video calling is trying to debug it. If it works on my end, it doesn't work 5% of the time in the wild. You know, we don't know that it's failing until people start to call in. So it'd be great to see in the logs, okay, you know, where exactly are the calls going? Like what point are they failing? What point are they getting to? That sort of thing. So logging is a huge thing. So basically, taking everything that iOS RTC is outputting and sort of capturing it ourselves, which leads to other things too, because you can do, you know, pretty cool things with the logs, like you can keep track of call duration and that sort of thing. And then tab cacher is a huge thing. So that would be great for us. You know, part of healthcare is like if we could have the coach or the doctor be able to see the patient going through the app, that would be wonderful for us. But for now, I know Google sort of has that behind a flag. So we're eagerly waiting for them to, yeah, release that for everybody, not just Hangouts. That's it. Yeah.
Great.
If anybody has any
Thanks.
Q&A or
Yeah, we have time for a couple
time?
questions. Anybody have any questions?
Have you done any testing with Angular 2.0?
Not yet. We're slowly starting to get our code into 2.0. So like we've converted most of our directives to components to sort of get into that mind frame. But right now we're such a small company and we're going for a Series B, so it's sort of not on the time frame right now. Yeah, too much stuff going on right now.
Go ahead, Jim.
Sorry, hi. Are you doing anything interesting with the data channel right now? Perhaps like taking data off a Fitbit or something like that and sharing it with a coach at all?
Yeah, for sure. Yeah. So right now we're doing Fitbit and we're doing Google or no the Apple device for health. You know, that sort of thing.
Yeah.
Yeah. So if anybody didn't hear it, she said basically if you're in the checking state, if you're in the ICE connection state checking, does that bubble up into an error and what error is that? So that's one of the things is when you're in that state, it's not technically an error. So you're in like purgatory. It's not an error. You don't know if it's failed yet. Maybe it's just taking a long time, that sort of thing. So it doesn't bubble up to anything. It's just you're stuck.